Greetings from Aster RV Hospital. I'm Dr. Shivani Chandan, consultant obstetrician and gynecologist and laparoscopic surgeon at Aster RV Hospital, Bangalore. Today I'm going to talk about one of the most commonly performed surgery done by us, which is a total laparoscopic hysterectomy. Now, what is a hysterectomy? It's surgery performed to remove the uterus from the body. This surgery can be performed through various routes. Most commonly abdominally, it's called abdominal hysterectomy. If the uterus is removed through the vagina, it is called vaginal hysterectomy. And if it is done laparoscopically, we call it as total laparoscopic hysterectomy. Now, laparoscopic surgery is commonly known as keyhole surgery. The reason the word keyhole is used is that we literally use a keyhole, an incision as small as a keyhole, to perform this surgery. That's how the surgery stands apart from the abdominal hysterectomy or the vaginal hysterectomy. During laparoscopy, what is done is a small 1 centimeter incision is put either through your umbilicus or above your umbilicus, through which a telescope is passed, and this telescope is connected to the monitor. So we can see the pelvic structures or the inside of your abdomen on the screen. And other secondary ports like a 0.5 centimeter incisions are used on the sides, through which instruments are put inside your body and the surgery is performed. Now, what are the most common indications for a laparoscopic hysterectomy? The most common being abnormal bleeding from the uterus, which is not getting relieved with medications. Second, fibroids or fibroid uterus, endometriosis, or any reason such as cancer or any abnormality in the uterus for which the uterus needs to be removed. Now, why should we perform a surgery laparoscopically and why not abdominally? There are a number of benefits of laparoscopic surgery. The first being that the whole abdomen is not cut. Hence, the blood loss from surgery is very minimal in a laparoscopic surgery. The second, the pain following surgery is very minimal compared to an open surgery, and hence the recovery is much faster. A patient is up and about the next day or within 48 hours of surgery. Hence, laparoscopic surgery should be the choice for performing a hysterectomy unless contraindicated. So remember that in an abdominal surgery, the pain is more, the bleeding is more, the recovery is slow. The hospital stay is longer. While in laparoscopy, the pain is less, the blood loss is less, the recovery is faster, and you're discharged from the hospital from any time after 24 to 48 hours of following surgery. What must you know is that we admit you. What anesthesia is given is general anesthesia, where we usually ask the patient not to eat anything or drink anything for 6 hours before the surgery. The surgery is performed and surgery can be recorded on the monitor so that you can see it later, and any sort of thing where you want to know what has happened can be shown to you. That is another benefit of laparoscopic surgery. So this surgery usually takes about 1 hour to sometimes we are done in 45 minutes. So anything between 45 minutes to 1.5 hours. Unless the uterus is enlarged, more time goes in delivering the uterus out, and hence the surgery can be prolonged. But otherwise, the visualization is beautiful, and hence the surgery can be performed faster. Now, what are the possible complications in laparoscopic surgery? Like with any other surgery, bleeding is a possible complication, but it can be dealt with laparoscopically itself. Very rarely bladder injuries, which I would say happen in 1 in 500 cases. Again, the bladder injury can be repaired during laparoscopy itself. Another uncommon complication is bowel injury, which happens in 1 in 1,000 people, and this again can be addressed and addressed better when the surgery is done laparoscopically. Now, coming to the recovery following surgery, usually we keep the patient for 24 hours minimum. If you're all well and about, we can discharge you following 24 hours, but usually 48 hours later you're discharged. So when you're in the hospital, you're up and about the next day using the washroom, and you're allowed to have soft diet the next day. The pain is very much less, so you use the washroom yourself. You're able to do your activities by yourself. Rest is advised for a very minimal period compared to open surgery. Once you're home, you can lightly walk around. There's no need for a strict bed rest, but adequate rest is important. You're usually back to your routine activities in 10 days to 2 weeks' time. You can start working again, you can start driving again. We advise that you should not lift heavy weights for 6 weeks following surgery. And most patients are back up to their normal, regular energy levels within 2 weeks, and sometimes a maximum 1 month. To conclude, when you've been advised a hysterectomy, opt or choose laparoscopic hysterectomy over open hysterectomy. The reason being the recovery is faster and the complications, even if they occur, are relatively rare compared to an open surgery and can be dealt with better during laparoscopic surgery. Since the recovery is faster and the complications are less, do consult us, visit us, as we at Aster RV Hospital have done over 1,000 laparoscopic surgeries, and we perform primarily all gynecological procedures through laparoscopy.